Hello, and welcome to your training on being an in-home BCBA. This training will talk about your job requirements, performance expectations, and some trainings that you're going to need when supervising the direct care professionals. So let's first start off with your duties and responsibilities as a BCBA. You'll be conducting assessments with new clients and on an ongoing basis as needed. You'll be collecting baseline data to compare with ongoing treatment data. BCBAs will create and monitor treatment plans for children between 2 and 5 years old, sometimes higher depending on if the child is still in our program after 5 years old, which is possible. Programs include targeting behaviors and communication, play skills, social skills, self-help skills, and many more significant behaviors that will help with a socially significant lifestyle. BCBAs will supervise RBTs and direct therapists to ensure that programs are implemented ethically and are grounded in behavior analytic principles. It is imperative that BCBAs know their literature in order to make sure that their programs are evidence-based. BCBAs are also to provide supervision to RBTs and direct therapists up to 1 hour every other week. Sometimes this may be more depending on the need, and also BCBAs are to coordinate this either virtually or in person. Ideally, the BCBA should be observing a home session and then give feedback either in person or through a document. And it must be done immediately in order for that supervisee to take that information and apply it for their next session. Also, it's important to analyze treatment data on an online data collection system in order to determine if the plans need to be modified, if it should be discontinued due to criteria being met, or if it's just, that the program's working and that we can keep going with the program. And lastly, maintain confidentiality through professional conduct. This is a big, important factor in our field. Confidentiality is very important to maintain our clients' identities, their families' identities, and also protect them from harm. As a BCBA, another responsibility is conducting parent trainings at least 2 times a month. You're also going to be expected to work in a fast-paced environment. This means be able to prioritize deadlines, prioritize needs, be able to go on the road from one house to another, have meetings in between, and conduct phone calls. Also, you must participate in monthly supervision with a BCBA supervisor. In your role as a BCBA, you have 8 clinical responsibilities to uphold. 1, dependability. 2, data analyzation. 3, communication. 4, cooperation. 5, decision-making and problem-solving. 6, assessment and treatment planning. 7, supervision to direct care staff. And 8, parent training. With dependability, this means that we want that the work assignments such as assessments, treatment plans, parent meetings to be completed by their deadlines. BCBAs are expected to spend extra time reviewing clinical research articles, evidence-based materials that allow them to perform their jobs to satisfactory level. BCBAs are expected to keep accurate records of clients, and also this must be accurate. So the data that you take on them should ensure to be accurate. This is necessary for BCBAs to fill in your role if you were to be absent or had to take a leave of absence of some sort. So make sure that any documents, notes, etc. are as detailed, are as accurate, and that a behavioral analysis can easily read it and understand where your treatment plan is going or where you left off. You're expected to begin work no later than 9 a.m. and work up to an 8-hour day. This does not include a half-hour break. And you are expected to be in the office, working from home, or in a client's home when you are working. So BCBAs should not be running errands. You shouldn't be taking longer than a half-hour break. You shouldn't be taking multiple breaks throughout the day. We are required to have 15 minutes with the additional half-hour break, but you should not be having frequent breaks throughout the day, such as, making personal phone calls throughout the day, checking personal emails, or any other personal type situations. BCBAs are also responsible in data analyzation. What this means is being able to look at graphs that are, which is data from the direct care professionals, and be able to monitor performance of the client. So maybe the progress is doing well, therefore you're going to continue the intervention. Maybe you'll look at the graph and it looks like the intervention needs to be modified, or perhaps the intervention needs to be discontinued because criterion has been met. So this is very important with data analysts. A behavior analyst also has a responsibility in communication, and this means effective and accurate communication. So be descriptive and behavior specific when training staff or parents. And what that means is, instead of saying to the trainee, good job, you can say, good job on conducting that DTT trial so quickly. I noticed you gave the reinforcer immediately after the correct response. So something that's extremely detailed so that the therapist knows that they're doing, they're implementing correct behavior and correct skills, and to continue those skills. Also, the use of language is also important, depending on the audience that you're talking to. So if you're talking to other behavior analytic professionals, such as direct care staff, supervisors, or again, coworkers, just make sure that you're using behavior analytic terminology. If you're talking to parents or maybe non-behavioral professionals, make sure you use lay terms, because you just want to make sure that you are meeting people at their level of what they understand. It's also important to bring up concerns to a supervisor, and communication's a big part of decision making, and just looking at challenging situations to resolve. So if you have a challenging situation, talk to a supervisor and be as specific as possible, be as neutral and objective as possible. And again, communication is a really important aspect for decision making and conflict resolution. Also, it's important to be kind, compassionate, and empathetic. So use language that shows those qualities. This is really important for feedback sessions when you're talking to supervisees or trainees, or parents. And also it can be helpful when de-escalating a disgruntled supervisor or parent. So sometimes when you show kindness and compassion, a situation might decrease in intensity, and you can progress on to a solution, or just talk about some other objectives that need to be discussed. So cooperation is another expectation we have on BCBAs, which is also very similar to our expectation of communication. In order to be a good communicator, you should also be cooperative. That looks like listening, being able to listen to concerns, suggestions, questions, comments, such as with parents, direct care staff, supervisors, and other professional and non-professional people that you contact on a daily basis. For cooperativeness, it's important to be eager to help and be available for supervisees or coworkers. You'll be expected to refrain from gossiping or engaging in other uncivil conversations about others. You're expected to accept the work activities of your role without complaining. Now, if there is something that's going on with your work activity, maybe depending on the specific situation, it's important to address this with the supervisor and be as objective and neutral as possible. All BCBAs are to work as team members. That means, again, we're looking at the client's best outcomes. So that's the focus, that's the goal, and we shouldn't let some personal issues or personal preferences with others come in the way of that. Lastly, it's very important to be respectful and courteous to others at all time. We want to promote BCBAs as professionals in our field, and therefore we should conduct ourselves as professionals. Another important aspect is being able to make decisions, specifically on non-behavioral treatment approaches. This can be something that happens when you're in a team of non-behavioral professionals, such as OTs or speech-language pathologists, teachers, etc. Now, in your role, you will not be in much school roles, but you will be working with parents, and you'll be working with guardians. You'll be working with, direct care staff who might not be as versed in the field of ABA. And it's important that when they start asking things or making recommendations on plans, that you revert to behavioral analytic methods. Now, there are going to be times where maybe you are working with somebody from outside, another professional such as OT, and they recommend a treatment plan that you feel is not behavioral analytic in the approach. There's ways to go about this, and there are ways in the literature that will help you through this. So it's really important that as a BCBA, you know how to navigate the decision-making process on non-behavioral approaches. And also it's important to make decisions on behavioral treatment as well. So what a treatment might be better than another treatment? Is there alternatives to a specific treatment that has less risks? Decision-making could also be in terms of family conflict or client conflict. Maybe there's something going on at home that the BCBA thinks is unethical, and it's also just trying to navigate that system of, confronting an unethical situation and making a correct solution. As a BCBA, you're also expected to know how to conduct assessments and do treatment plans. So for assessments, you're going to have to do indirect assessments, such as indirect interviews, VB maps, direct observation, collecting ABC data through, analyzing a student, and FAs. It's also important to know how to assess baseline, determine treatment goals, and methods of measurements and criterion for discontinuing goals. Another clinical responsibility is supervising direct care staff. What that will look like is you'll be supervising them at least one time every 2 weeks, sometimes more if it's needed. Training sufficient exemplars is important, such as being able to give them opportunities, multiple examples of a skill. And this will help them perform the skill better. But also you can use some other methods, which we'll talk more about in the manual, such as BST, and that incorporates modeling, instruction, feedback, rehearsal, etc. Some areas that you're going to be teaching direct care staff are DTT, which is discrete trial training, FCT, functional communication training, prompting procedures, differential reinforcement, schedules of reinforcement, and how to collect data. I also am going to talk about in our manual a few other ways to train direct care staff, or 2 things that you can use that will help them in their own role with clients, such as antecedent strategies, and also TIP, which is a specific training procedure for children to learn for manding items. Then the next responsibility is also parent training, which can be very similar to the supervisory training. You're still going to use BST, which again is talking about what the skill is, explaining what the skill is, showing the skill through modeling, having the parent rehearse the skill, give feedback, and then continue the rehearsal and feedback till the parent seems to be comfortable and is meeting criterion. This is really important for the child's generalization across people of the skills, such as through the therapist and also through family members, and it also will help the child maintain the skills throughout time, which is something we definitely want to make sure is happening after our services are discontinued. Administration responsibilities are also very imperative for our role, such as being able to case conceptualize, manage deadlines, organize data and other important information, and also keep the confidentiality of clients confidential through documentation. This could be through locked platforms on our computer or locked filing cabinets, and being able to also have specific documentation signed before treatment occurs. And this is also an administrative responsibility because you're not actually doing the ABA part, you're doing the background, the paperwork part. So again, you have to just make sure you have all the paperwork done before going into a treatment plan, or implementing a treatment plan, I should say. There are also a few general performance expectations in regards to meetings. Meetings with supervisees, such as direct care professionals, you should be providing effective staff training in performance management, and also you can use some diagnostic criteria measurements with the goals. Also, parent meetings should be done 2 times a month, as I explained earlier in this training. Conducting indirect assessments are important. Implement skills training through BST. Monitor performance and use performance feedback is also very imperative. Also, we may at sometimes be in multidisciplinary team meetings, depending on the client. So that could be with a teacher, an speech language pathologist, some EI professionals, etc. Also, supervisor meetings also are to occur 1 time every week, and that is on a Monday, and that will be with your supervisor. Other general performance expectations are time off and sick time. So time off, if you're requesting time off, you must inform a supervisor no less than 2 weeks. And also, if the vacation or the time off is longer than 1 week, you need to have that approved by a supervisor, depending on the situation. And also, you must have coverage for your clients. Staff who are 40 hours are eligible for 2 weeks of vacation. And according to the department leave policy, you can take time off immediately, but you are expected to call the director as soon as possible if this is the case. You will be expected to call a director if you have a leave of absence or any other type of situation that requires an immediate leave. Sick time is also something we give our employees who work 40 hours. You get 2 weeks of sick time. Just make sure you call and let your supervisor know or through a text that you are not going to be working today. And also let your direct care professionals or any parents that you had meetings with or any other person that you worked with in the day to let them know you are not going to be working and that whatever activity you were going to be conducting for that day is going to be on hold. Dress code. So we have general tips. Specifically, we have 4 in particular. Clothing should be clean and fit well. Clothing should not be revealing. No low-cut tops or mini skirts. Make sure clothing is ironed if needed. So you don't want to be showing up with wrinkles or just clothes that look very unprofessional. And clothing should not have any stains or rips. So again, we just want to make sure we have clothing that looks, it could be casual, but also be professional as well. You don't want to look like a slob because, again, we want to make sure that we are presenting the feel of ABA professionally, and we want to reflect that. So just for some examples, that shirts can be blouses, button-up shirts, collared shirts, or just nicely fit shirts. You don't want any, writing on your shirts. Just make sure it's plain because you don't want anything vulgar or distracting. For pants, you can wear slacks, khakis, or skirts. Make sure that skirts are knee height. Or you can also wear, skirts that are longer or dresses that are also knee height or longer. Closed or open shoes are okay as long as they're not flip-flops or heels. We don't want heels either because you're working with kids, so it's really not ideal to have heels. Also, any color is appropriate. You can, mix and match whatever colors as long as it's not too distracting. We're going to have a brief training for the for our BCBAs that are going to be working with direct care staff. So first we're going to be talking about performance feedback and how you can deliver this when observing supervisees. You can also be using we're going to talk about performance monitoring, which is also something you will be using with your supervisees. BST is another area we're going to talk about. This is to increase skill acquisition with your supervisees. And also we want to talk about antecedent strategies and TIP to teach our supervisees so they can implement it with their students and clients, and also with parents. During our training today, we're going to be using BST, and we're going to use BST with our manual that I'm going to provide for you. So the manual will identify 5 crucial skills needed for the BCBA job. The manual will explain how to deliver these skills. So again, you're going to have instructions, and the trainer in today's presentation will model the skills for you. Each BCBA will partner up and rehearse the skills to do a role play scenario and present it in front of the group. The trainer and BCBAs watching the role play will deliver positive and corrective feedback. And lastly, we will continue role playing and delivering feedback until mastery of the skill has been met. And this concludes today's PowerPoint. So congratulations on your new role, and let's dive into the manual. So now we're going to talk about are trainings for BCBAs that we'll use when supervising your supervisees. So let's first talk about performance feedback. This is extremely important. It will help keep our employees happy, motivated, and also just help them feel confident in their role while also being able to increase their skill set in order to provide for a client's best outcome. So let's get started. Let's look at what positive feedback is and some tips for it. So again, positive feedback is when a supervisor will look at the strength of the supervisee and comment on it. And again, this is going to be behavior specific. You don't want to be vague. You don't want to say good job doing that trial. You want to say good job implementing reinforcement quickly during the DTT trial. So first, you should start the feedback session with a positive or empathetic statement. That might be, thank you for meeting with me today. Oh, I really appreciate you taking the time to have me come to your session. Something that shows that they are doing a good job. Find a few areas where the individual performed the task correctly. Again, that's what I was just talking about, behavior specific. So you're going to say something like, oh, I love that you did the high P's so quickly after one another, or I love that you found a reinforcer that was a highly preferred reinforcer compared to the other toy. Be behavior specific, let them know the skill and the consequence for performing that skill accurately, which we just talked about. And lastly, only deliver positive feedback on skills that attain criterion. If you're giving feedback that really shouldn't be given, that's going to give people a false understanding of their skills. Also going to maybe make them feel more defensive when constructive feedback happens because they're more used to hearing the positive. So you just want to make sure you're not overdoing it, because there are times where people want to just make the person feel confident, but they're reinforcing behavior or skills that are less than adequate. So constructive feedback is, feedback that are about skills that either need to be developed or need to be improved. It's important to remember that constructive feedback is looking at improvement and not at what the person's doing wrong. So therefore, use language that focuses on improvement and stay away from saying something like, oh, that's not right, or you did that wrong. Deliver at least 5 to 7 positive feedback comments before delivering constructive feedback. That will get a good momentum going. And do not use constructive feedback as a focal point for supervision, such as using only corrective feedback. That can really make the supervisor and supervisee relationship erode. It will make the supervisee want to avoid the supervisor, or maybe not want to ask the supervisor for advice or help. It could also decrease job satisfaction and performance and create an overall very poor work environment. Constructive feedback also should be behavior specific, so make sure that when you tell them the skill that needs improvement, that you also provide an alternative skill or an alternative behavior for that. So, instead of, let's say, you're telling the kid, okay, clap your hands. Maybe you keep hearing the person say, Dan, clap your hands, Dan. You would say, let's work on your trial. Instead of saying, Dan, just go into the SD, clap your hands. That way you're not just saying, okay, don't say Dan, that they might replace that with something else like, hey, over here, clap your hands. So you just want to make them aware that what the skill deficit is and how to replace that deficit with the desired skill. Also, it's important with corrective feedback. Some people could be defensive, so make sure you listen and validate someone's feelings if they do become defensive. And also, do not deliver constructive feedback in front of others because that can be very belittling and degrading. Lastly, there are some general tips for using both feedback methods. Be genuine. Again, you don't want to be making up positive feedback or corrective feedback. Be as genuine and neutral, objective as possible. Feedback given as soon as possible after the observation has occurred, and also feedback should be documented both, for the supervisor and for the supervisee. Next, we're going to be talking about performance monitoring. This is also important because as BCBAs, you're going to be supervising the supervisee, and that looks like monitoring their performance by direct observation, using some diagnostic criterion to assess their performance skills, and also just looking at yourself as a supervisor, such as asking questions as, am I being an effective supervisor? How can I help them more? Or maybe my approach isn't working. Is there another approach I can use? So the supervisor should actively observe on the job to determine areas in that the supervisee is doing well, and maybe some areas that they need improvement with. With performance monitoring, you're going to be using feedback as well, just as discussed in our earlier training. So these two really go hand in hand, and you can't have good performance monitoring without good feedback. Vice versa, you can't have good feedback without good performance monitoring. Next are tips for informal performance monitoring. This is when brief observation of the individual is observed on the job performance. So as a supervisor, you're going to be going into their area, but you're not actually there for that specific reason. Maybe you're getting documents, or you're, going to talk to a parent or something. And while you're there, you're watching the supervisee. So asking the supervisee how the supervisor can be of assistance is also a way to conduct informal performance monitoring. And also informal performance monitoring is conducted frequently. There are also tips for formal performance monitoring. This is use of diagnostic feedback to show the supervisee's work proficiency is either doing well or maybe it's less than adequate. Use of intentional observation. So you're going to tell the supervisee, hi, I'm going to come in at 2 p.m. and observe you from 2 p.m. to 3 p.m. and this is the specific skill I'm looking at. Make sure that data collection of skills is being done. Monitor during predetermined times, as I just talked about. Let the supervisee know when they're observed, which is also what I just talked about. The supervisee should be kind and courteous throughout the monitoring, and feedback given at the end of the monitoring, which can be delivered either verbally or written, is important, and feedback from the monitoring should be documented.